I bet you're
Okay.
going to love it.
I am recording. Good morning. We
Good
just had an
morning.
informal check-in, and now I turned on the record button so that
I see it. I see
Oh,
it.
do you see it?
It's recording.
Yeah. Oh, yeah. Good. Oh, that's good that they let the other person know.
Mm-hmm.
I was, preparing last night in my mind and doing some reading and trying to, make sure I do this right. And I don't take a lot of notes, but because I have a good memory, except for when
Good for you.
I'm very proud of it still. I really do.
Will that be your measurement as you move forward into?
Yeah, I hope that, and no, it's interesting actually the way I have a very good, I have a semi, I have a very visual and photographic memory in a way. So I just need to sometimes just kind of remember one thing and then the whole story will unwind.
That's great.
But I don't remember I remember I wanted to actually document what we said about your goals.
Oh, I'm going to have to remember them, huh?
Yeah, I do remember, but I want to make sure I got everything. You're excited about this addition to your supervision. I added excitement. I don't know if you said that. To explore arts-based interventions.
Mm-hmm.
And I remember that. And I remember, because I remember expressing a little anxiety about something about treatment planning.
Right. And it's that, I think that phrase means two things. That means the actual thing where you write down and then you make long-term, short-term goals.
Yeah.
But the other one would be recognizing what the goal is, because I know.
Oh, yeah.
There's a chance it's in your head. Like somebody gave me a client when she was leaving and they were working on boundaries.
Got it.
And it was really easy for me then to keep moving forward with that framework.
Yeah.
So I think I need to figure out, how am I doing? Like obviously trauma, because everybody's here for trauma, but I think it's different for every kiddo or every teenager that I work with. So
I think one thing I need to know more about around that, and around the way you work or aim to be working or find yourself working, is how directive you are.
Oh, not very.
Right. So
that's hard. It's really hard.
It's interesting it's like you hold that awareness in you during the session, but I assumed that you were non-directive. So how, I guess, yeah, so maybe I have some thoughts, but I'd like to hear yours. Like, so how do you envision treatment planning or goal focus when you tend towards non-directive?
So part of it is really just tracking progress. So I'm thinking when I create that goal, that treatment plan, it helps me measure. So what I'm learning from some training I took recently is I gather information, like I'm focused on children.
Yes.
I'm gathering information from the adult where they see the problems are with this child at home. And I'm gathering information I know about those behaviors and how I can see a way to create a goal. Mm-hmm. Because if I then see progress in the goals I'm seeing as a clinician, but at the same time giving some relief to that parent, hearing what they're saying, giving them tools, because I have a partnership with them, I feel like that's a direction I like to go with my children, is not only seeing what I see and helping that be resolved or changed, but also what the parent sees. And sometimes it's just having the parents see their child differently and understand their behavior.
Interesting.
Yeah.
Understanding the behavior.
Yeah.
In the way that you can help them.
And then giving the parent tools to meet the challenging behavior that they feel like is really a struggle for them to handle. So that's clear.
So what I hear you, I think, saying, and I'll reflect it, and it does reflect what I think I do, is with here's the benefit of working from home, dogs barking in the background.
They don't bother me.
It's
construction that would bother me.
Yeah. Okay. Noted. that you gather information, of course, at the onset from other sources than the child, to know what some of the challenges are,
Mm-hmm.
or even, if the parent doesn't name its boundaries, but you hear you hear the problems, and then you make your assessment based on what you're hearing and think, okay, boundaries, for instance. And then you're in a non-directive play session, you hold that awareness. So you're looking for indication of that, and also progress in that.
That is the wish, all
Okay.
of that.
Okay.
Because I started in February seeing clients, and I found myself rushing through intakes, not getting as much information because I was trying to build rapport with the parent. So they're telling their story, which means we get sidetracked or hung out in one area. So what I'm learning since then is I go back and I want to learn more about that child, and what more of the struggles are. Plus the parent has we have a little bit more of a connection in that first intake.
Yeah.
So, so what you just described, I'm getting better at trying to do all that up front, or just putting in a play. Because right now I'm trying to work with a parent because I'm finding out more things. All she says is, I just want to forget about the sexual assault that happened to my 10-year-old. And that's the relationship she and her daughter have at home. Mom wants to totally forget about it. I want it to disappear. She's ignoring it. And this child has disappeared and lost herself.
Oh, you just gave me chills. Yeah.
Right. And so I've been working her telehealth, since March. And they brought her in finally. And then I start setting up weekly, now bi-weeklies with mom. And
good.
But I didn't get that right away. No. And so it's okay. Everybody's safe, but God forbid, well, we never know what's going to happen. But so the non-directive part is I hear all these great ideas and see these great ideas for clinicians who have this activity for this activity for that. I'm too afraid to let go of my client-centered approach.
Oh, okay. Yeah,
to incorporate
too afraid? That. Okay. Say more about too afraid.
So, well, I feel more confident in the playroom of being client-centered.
Mm-hmm.
And so far with the clients who I've been client-centered, it's been just right for the child. I spend a lot of my time building rapport. And then as we get to a place, then I can, layer in deeper reflections or responses, that kind of thing. It's the telehealth part where I don't know how to do some of the stuff telehealth. I don't have all my stuff, but people are saying and showing me all these amazing things, and I just can't connect with it yet. Like, that means I'm in the driver's seat. Even in all of my past work, I hated being in the driver's seat. I like to create the environment.
Got it.
And the atmosphere for the child to take me where they need to go.
So we're talking about your ideal way of working, and then how different it is in telehealth. I imagine, I was picturing you in the room with kids, of course, and I imagine non-directive via telehealth with kids is.
Yeah, it works with some because they've got stuff in the room and they're imaginative.
Yeah.
Now, yesterday showed me an example of, yes, I have great ideas to use with children when they're having an issue. Like, I'm working with a mom because he's 7 and telehealth just wasn't happening. So we shifted to child-parent relationship therapy, where I'm teaching her how to do play sessions with lessons. So we have interactions weekly that all my cool ideas or activities come to the surface, and I teach her how to do it.
And I love that too. That sounds great. And I mean, really, I think that if you can have a parent on board with that, that's just.
Oh my gosh, absolutely.
I mean,
that's
like the magic wand that we can wave in the room.
Yeah.
And I'm not meaning that in a cynical way this time, because when I worked with kids, it was very non-directive, but I would hear from parents what a change there's been. And I'm like, internally going, it's kind of like magic.
Yeah.
And I didn't have I had some, but not much training in the parent-child relationship stuff, which I thought sounded so great. So I'm getting that working with the parent, being goal directed, it's you can do that, and being with the child, your philosophy and belief really stems from the non-directive magic.
Yeah.
Um,
But I am going to be incorporating when it comes. I haven't found the right time to do some of this, but
yeah,
that whole uh, self-regulating behavior, like teaching
yeah.
the mindfulness, like I've been I teach
Mhm.
parents that very easily how to do it with their kids, but in the sessions, I'm not finding a place to always teach it. Whereas
Yeah,
everybody uses that here. Everybody always
I
says
love
you
it.
have the five senses connect activity, you have this type of breathing technique, you have tapping. So just being more comfortable and confident of where I layer it in and when do I bring it about, you
That's
know?
okay. That's a good question to hold in your um, awareness.
Mm-hmm.
I'm going to stop for one sec. I realized that I had intended to start this session a little differently. We got on because we can talk.
Yeah.
Backing up, I'm not forgetting anything we've just talked about. It's important, um, and we're going to be using it. I wanted to and what reminded me was maybe one of my kind of a solution to that, what felt like a question right there.
Yeah.
Oh, well, let me just articulate that. What I was thinking when you were speaking was you want to um, be able to incorporate more mindfulness and tools around de-escalating and awareness of their senses. And what I was thinking was, and then reminding me what I wanted to do, was, is it possible that that's how you open your sessions and then move from there?
Mm.
So this is how we check in together.
Oh,
Then
that's right.
as
Yeah.
soon as I thought that, I thought, oh, that's what that's
You
how
had a
I actually
plan.
wanted to start. That was the plan I had for today, was before we got into the cognitive verbal stuff to, and the way I work, I don't like, my plan is like loose, but I just wanted to like give us a moment to check into our bodies.
Sounds good.
So, um, it's funny now, I'm recalling a dream where I was leading someone through meditations, like starting with the toes. So I must have been thinking about this, but yeah, maybe just well, actually close and open, close and open, close and open. Notice the difference. Take a little longer. Close, open, close, open. And now with your eyes closed, reflect on your memory of them open, and did it feel different in your body? And maybe you need to open them to notice that. What happens for you?
It's nice to close this all out, you
Yeah.
know, and
Yeah.
then
So when you can be more, when the eyes are closed, you're more able to, for me, I'm able to pay more attention to what's going on in my body.
mm-hmm.
And so with my eyes closed, I can ask myself, I hear, what do I feel? Maybe just lower my shoulders. What do I smell, taste? Where's my breath? And is there anywhere in my body that is calling my attention? Could be something that's more physical, like a tight muscle, or I could be a little anxiety somewhere. And even with your eyes closed, the one sense that we think we're not using is I see, but maybe it's more of a mind's eye, I see. And then whenever you're ready, you can open your eyes.
Do I have to?
No, you don't.
I'm kidding.
Yeah, I know you
It's
are, but it's
nice
a good
because
question.
I try to do that before some sessions.
Uh,
And then I go, oh, and I have to write a quick note about something so I don't forget.
yeah,
And then I try to do this. Oh, wait a minute.
okay.
So it's better
Well,
to
yeah, and
date
I
it.
hear, yeah, and you say you try to do that before sessions, so maybe that's something I can encourage um, you to remember. It's just a way to check in. And now with your eyes open, and this is something I think that's so simple to do, maybe as an opening, because it's calling upon that, mindfulness stuff.
Mm-hmm.
And I just, I think maybe this exercise around when someone's sort of dysregulating, just to be, feet on the floor,
Mm-hmm.
and then asking, I see, I hear.
Yeah, the name
Yep, name for
five,
a
four,
quick,
three, two,
yeah.
one.
Mhm.
Yep. I use it very actively with one of my clients and
Great.
one of my kids.
Good.
Yeah.
Yeah, and it's nice. It's a nice. So you're telling me, you were telling me earlier, I have difficulty incorporating that, and now I hear you saying I use it with
Well,
my.
18-year-old,
Yeah,
so that feels
yeah.
comfortable. Maybe one of the things I'm not recognizing is because I can't see the whole body. Is
Hmm.
sometimes I can see when a child is,
I know.
not regulated. And then even here, when I'm in the room, see, I think sometimes I'm trying to capture so much in the time I'm with a client.
Okay.
Sometimes it doesn't hit my head till later. Oh,
Oh yeah,
they were a little
that's right.
anxious, and so maybe that's what I'm still trying to time sequence and respond to it quicker. Um,
Okay.
you know, and then when they're in the room, if it is, even with my 12s and my 15-year-olds, when they're in here, I feel like they're finding a place to take care of it because they're doing sand tray or they're playing in the sand or they're manipulating artwork,
Mm.
and so sometimes I feel like they've already gotten to what they want to do
I
with
see.
that.
Yeah, and teaching them to trust that when you reflect, oh, I see you found a way to calm down by something or othering.
Yeah, and I think that's what's the part I need to remember to do, what you just
Okay.
said.
Yeah.
Yeah, I noticed
'Cause-
that when you start to feel that way, this is what you're supposed
yeah.
to do.
And
You
there's
know,
less, so okay. All right, just to stop for a sec. I'm also aware, and learning to be a supervisor, I think it's important to, and I didn't set an agenda with you, but I'm okay with it being like, we're both sort of non-directive and going with what
Yep.
comes up, right? So maybe a point that I'll make in my own learning is not everybody is, and I think this drives some people crazy.
Mm-hmm.
And I actually think it's nice to know, okay, we've done this, we've done this,
Yeah.
to walk away and feel like, so, and again, and I can do it in retrospect. Here's the goals we met
Right.
on our agenda, but just want to put a pin in that I didn't actually tell. I don't think I asked you to do anything at the end of, like, I didn't say prepare blah blah or
Nope.
think of a case, bring a case or anything like that. So I didn't want to put you on the spot. and I feel like we can still be talking in general about, because supervision is also about tuning your skills,
Mm-hmm.
and a good way to reflect on that is if we're talking about a particular case, and that's always welcome. And I know you have other supervision, so it's not like a burning need that we're missing here.
Okay.
But I always find it interesting. And then doing what we're doing. So maybe our agenda for today is to be speaking more in general about the things that we are, like that fall into the category of tools
Yeah.
to support your growth as a therapist
Uh-huh.
in
I
general.
mean, just that section we just did now. I mean, I'm forgetting. Oh yeah, I can do check-ins. Of
Yeah,
course.
and
And
I
here's an
think,
example of how to do a check-in.
right. And what's nice, I mean, there's lots of things I think we can both pull out of an experience like that, which really doesn't take much time. But like, well, especially when it's on telehealth, it's not the same sort of ritual of creating the space
Mm-hmm.
together, or the walking into the room is like, now we've crossed the threshold into this safe place.
Mm-hmm.
And I find that, and the walking out of the room, it's so much more in our body. We feel it more and can transition different than just going bye, click.
Oh yeah, because this is what it is. It's like this. Great. I'll see you next time.
I
Click.
know. I know. And yes, and I feel my growing through telehealth has been to, like, I mean, of course, talk about like the time, and pay attention to, like, just naming that, okay, we have a little bit left or whatever. Even with it, of course, I'm not working with kids, but even with adults, like, as a signal, let your mind and body be prepared for the transition. But I think it's, if there's any time to be more structured and non-directive, it's like in creating the space and then leaving the space.
Mm-hmm.
So doing a check-in ritual together like that,
Yeah.
and there's lots of different ways to do something like that, but it's like also doing it together. You're not just giving directions to the kid and watching them. Let's do this together. And giving some rationale. It really, lots of information can be found in our bodies, and we
Mm-hmm.
might not be paying attention to it. And I know you're working with kids with trauma in their bodies, so of course the wording and just, and the the safety around that, but just
Mm-hmm.
lots can be found in our breath, or lots can be found in our imagination, or when we do
Yeah.
something like that. So and it's a nice way to join together. Here we are together doing this thing to prepare us for this experience we're about to have.
And the thought that's popping in my mind is the fact that if it is part of that ritual in the beginning, certainly with telehealth and connecting, they're starting to think about it before they even click into the waiting room, or
Mm-hmm.
I show up, they go, oh, she's going to ask me, let me check. So then it maybe becomes automatic that they do a body scan. They think of what level they're at,
Yeah.
if we do it often enough, because here they have like these little things with these little smiley faces that you could pick your mood for the day.
Yeah.
That's kind of cute and everything. But for me, when I feel like I hold up
It's
stuff,
still
first of all,
very
it's hard.
external, right?
Yeah. So it'd be fun for me to pick a new one that I'm really into, in a sense, to say, and practice with them and engage whether or not that's a good fit for us. Because it might not be a good fit for one client for the next. Because, sometimes
Right.
I feel really silly
Yeah.
with an older kid doing certain things where I don't feel silly with the younger kids.
Right, right. Okay, yeah. And notice that too, like
Mm-hmm.
that's something to be aware of. That's some, that could be explored as a countertransference thing, right? And so,
Mm-hmm.
or your, what's going on for me that I feel silly? How do I know that, if I'm, there's lots of information there, and if I feel convicted about this and do it in a way that's appropriate, maybe they would really love it too. But
Yeah.
um,
I feel like I'm an authority in my space here.
yeah,
Like
right.
I know exactly how to step in it and how to be in it. It's this telehealth part, I think, that with some clients I'm more comfortable, whereas other clients I'm not.
Yeah,
Because I do
yeah,
have that my own thing going on with talking about sexual assault with a 6-year-old whose father did it, or a 12-year-old who kept it a secret for 2 years.
mm,
You know, I've like caught myself not addressing what the issue is.
yeah. Good for you.
But when we did, that child is ready to talk about it.
They
They don't
just
need to,
want. I know.
they're
They need
ready. They want to
permission.
talk to somebody about it, you
Someone
know?
who can hear it. Yeah.
Yeah.
Like
So,
not the mom who says it didn't happen,
right.
or we're gonna forget all that.
Exactly.
Yeah, good for you for noticing
Mm-hmm.
all those things. But
Mm-hmm.
yeah, so there's yeah, so it's a nice opening ritual, but also to, like you say, sometimes I forget. Well, it's, you can do it right in session with them.
Yeah.
So if you forgot to do it in between sessions, or you got carried
Right.
away with administrative things.
Right. Or running to the bathroom before the next one so that
Uh-huh.
I could do it right in the session.
My colleagues, when I was at Ozark Guidance, I mean, I drink a lot of water and I always have, but I started to become self-conscious of the fact that I went to the bathroom between every session.
Mm-hmm.
And I'm not, it didn't matter to anybody. Of course, I can pee as much as I'm allowed to pee as much as I want. But someone noticed, like just observed it and said it. And so I actually have thought about it. I mean, I think there's something about like taking care of creature comforts, because I want to be so present in the room that if
Yeah.
I have to pee, then it'll,
Oh, for sure.
right? But
Mm-hmm.
like, I certainly, when I'm home during the day, when I'm not with clients, I don't pee every hour.
Mm-hmm. Right. But you know you have a window. Like you just know
Uh-huh.
you're going to have to go try whether or not your body's saying you have to or not, because in that
Right.
next 40 minutes, you're going to have to.
But deeper than that,
Yeah.
I wondered about it and thought, I think I'm releasing. I think it's my transition between each session.
Yes. Yes.
And that's the way I look at it now. Like I kind of need
I
that
love
in
it.
between. So even if you think, you know, like I'm like, I'm not doing my mindfulness and I'm not doing my preparation for the next session, or I'm not, you know, transitioning my mind to the next person because it's going so fast. Nope. I'm taking that little moment, and I feel like now I'm going to, I encounter it as, that's the energy I'm releasing
Yeah.
through my pee.
That's a riot. I love it.
You know, letting go of the whatever energy, if it's toxic or not, just letting it go and
Mm-hmm.
preparing myself for the next. So, you know, us creative people can come up with anything.
So I'll be thinking about you next time I pee in between sessions.
Yeah, and you know, like it is stealing a moment of breath in between. It really is.
Yeah.
And it is a moment of self-care, even though it's something we do every day, many times.
Yes.
But yeah, I'm like, yep, I pee between every session. And
I'm grateful for no lines in the bathroom.
right. Right. And it's just like a forced way to give yourself that space in between. It's something
Mm-hmm.
like, yeah, we
Because
might
I
just,
have to leave that room. I just have to get out
yeah,
of there, even if it's for a minute.
exactly. It feels like a sanctioned and appropriate way.
Yeah.
And like it might not be it to say between every session, I need to walk around the building twice. Like, nope,
Mm-hmm.
we don't got time for that.
No, unfortunately.
But let's do a transition that's like sanctioned and appropriate.
Sanctioned and appropriate. Love it.
So, yeah. So, in terms of the sort of the question around, I like, because I don't want you to, like, in my mind, I think if non-directive is your jam, because I support that, that's mine, then why would we beat that out of you? but let's find, right?
Yeah,
But
yeah.
what you're saying is, but how do I find those moments in there to maybe gently shape, not just in the reflect, I can reflect. Yeah.
Right, because when you say gently shape, I always say it's also like coming to where the client is, that I don't want to show up
Yeah. Here's what we're doing.
fully scheduled,
Yeah. Oh,
but I'd feel much better when I'm working with these teenagers that I have something like, let's try this.
mm-hmm.
Like color my heart is really easy, but I feel like once I do it, I need to wait a little while to go back to it, right? But I would love, since I have several who like to do art, I love to be able to say,
Have
because I'm in the
something.
beginning phase. I'm really in the beginning phase with this 13-year-old, very beginning phase. We've had bad connections with the internet, so I'm already like revved up, and
Yeah.
and I'm just trying to give her a place to start talking. But I also feel like we need to be trying to release in other ways, because as a matter of fact, yesterday I said, I'm trying to use some different prompts. Tell me about the worst and scariest thing that ever happened to you. Now, she didn't even talk about what happened to her. She
She's like,
talked
come
about
on to you, lady.
a dog one of her dogs that almost died. But
Oh,
as we kept walking through it, I found out she had to leave very quickly from the home, and then things she couldn't take with her. So we hung out with things that she had to leave
yeah.
behind.
Loss. Mm-hmm.
Yes, you lost. And then what do you wish you could have gotten, to were there other things that you wish, that were different? So it kind of got back to the town of
Yep.
where it happened. And then eventually the dog came back up again. And if my mom and stepdad, who are very irresponsible, go to jail, what are the plans for the dog? So
Oh,
we
yeah.
kind
Good
of
for
touched
you.
on the abusers,
Yep.
but
Right.
in a whole different
Right.
way.
And I'm sure that, yeah, so you're listening for it. And obviously, well, maybe not obviously, I'm wondering if there's some sort of external agenda that makes you feel urgent about uh, that information coming out.
No,
Oh,
I think it's me. Yeah, I think I'm making this part up, that external. Am
yes.
I
Okay.
supposed to be moving quicker? Am I
Oh,
taking
yeah.
too long?
Oh, yeah.
And
But your knowledge, I mean, because, you are a new LAC, but you're not new to this field, and you're like an expert in play therapy. So,
mm-hmm.
so that's interesting that your knowledge and wisdom says, take your time.
Mm-hmm. Mm-hmm.
And your,
Sometimes.
uh-huh. And maybe interfered with
Yeah.
assumed expectations. I'm supposed
Yes.
to do my job in this certain way. And
Mm-hmm.
I hear people talking about da da da, I should do it too. And
Yep. Yep.
so sort of doubting your, just casting doubt a little bit on what you really do know.
Mm-hmm. I
Um,
think that's true.
Interesting, last week our assignment had to do with, it reminded me of you, and it gave me something to think about. Not like the scenario was different, but so the case example had to do with a woman who had been a middle school teacher, and also she was an LPC with middle or older kid age, and now she's coming to supervision as she's moving into a new role as school counselor with very littles. And one of the things we were asked to reflect on was, what assumptions might you make about this woman's expertise or at all? And I thought, oh yeah, I think I've known you for so long, and I've always looked to you as an expert on something I could know more about,
Mm-hmm.
which is still true. And here you are in a new role. So I don't want to make assumptions about, like, in my head I hear, oh, Lulu, come on, you know all this stuff. You can do this. But it's a new way of doing it. You haven't
Yes.
practiced.
Yes.
So I want to be mindful of that, like that I'm
Mm-hmm.
not making assumptions about I know your wisdom and knowledge, but I don't want to make assumptions about how it feels for you to be putting it in practice.
Yep. Yeah.
Is it,
I'm so afraid of breaking a rule and not doing things. I mean, everybody keeps saying, oh, you're such a 6 Enneagram stuff. I
Yeah.
don't know it well enough to know, but
too.
I just know I have anxiety about the responsibility of this job.
Yeah, sure. And like, as far as jobs go, you are in a place where that would be, I mean, it's always important, but it's like,
It's a huge responsibility.
yeah, it's a big responsibility.
Yeah. Yeah.
Um,
And just still
You're
learning.
seeing kids critical cases all the time.
Yeah. And just learning about trauma. I think I feel so new to that. I'm feeling better
Good.
than I did in the beginning, but I still feel like there's so much to learn. And so, but I've been treating clients without not having all the trauma knowledge, so I should honor that. But as I learn more about trauma, I feel more confident.
And when you hear, I wonder if you're having this experience, because I mean, I've been doing this for so long, like 25 years. And now, for the past, let's say 7 in my awareness, maybe not as, like, just all of a sudden trauma, like the word, just thinking about, learning about, training about, being a specialist in. So that brought up anxiety for me. Ooh, I'm not trained. But when I do get trainings or reading or listening, I think, okay, I think I knew all that intuitively, but right? Okay, so I just wanted to support that you actually know a lot about trauma in kids.
Yes, there is that intuitive thing, and it's just really nice when you read it. And you're like, oh yeah, I did know that, right?
Yeah. I recently reread The Boy Who Was Raised as a Dog. Have you read that book?
I'm trying to remember if I did. I think I saw him.
Bruce Perry.
Did I see him speak sometime?
He's a big wig again. Like, he's just really made, because
long time ago, I think.
Because he was on the forefront of this like trauma stuff in kids.
Yeah.
And now it's such a big awareness that he's really out there again. And he's, did you see him? I
think there's a chance that many eons ago, when I was going to play therapy conferences, he may have been one of the guest speakers.
I bet. Yeah. Well, I just recently reread it. There's it's been edited with some additions.
Oh, okay.
And I mean, asking people to read things, I know it's like, but I listen to audiobooks, so that helps.
Yeah.
But it was exciting. I loved it, listening to him, and also reminding me, like, I might not have had the lingo or the concepts to articulate, but I think that he just feels really aligned with how I see people. And well, but he broke rules, like he was a intern or whatever, and he like got in the car with people and took them grocery shopping, and with a mom, and like, because his morals and belief in joining in relationship was therapeutic and not breaking a rule, and I like that.
I do too. And I'm reading The Body Keeps the Score.
Oh, yeah.
And how he found his way in the system that he came up in his education.
Yep.
And I'm just at the beginning of it, but I'm also listening, and I have the digital book of learning more about the polyvagal.
Yeah.
And that finally made my brain get it. Like, I shifted to go, physiological, not just.
And yes, and because we're old ladies, I am anyway. We've been in this work a long time. We've been doing this stuff before the neuroscience was being explored.
Yeah.
And I find it so exciting, because it does, sort of scientifically affirm stuff that I feel we've been doing for a long, knowing in our body.
Absolutely. Yep.
And I actually, I have not articulated this, but I actually think, I'm glad I came about it this way, because I have a embodied experiential learning around that. It's not just coming into my brain through a book or a training.
Yes.
And going from that way. But that's me being the bottom up, not the top down. So
right. And I love that. And the thing is, it's so much easier now that I have clients the learning is even deeper now. When
Yeah.
I used to go to all these conferences
Yeah.
pre-clients,
Right.
and this is easier because when I'm reading in the book, I think of a client or
Yeah.
two or three of them, and
And
then
you,
that
it,
helps
yeah,
me
good.
get them or understand where I might be able to meet them or work with them, you
Yeah, it's
know?
good stuff. It's good stuff. I know that for me, there's some, like I haven't one of those attraction repulsion things to like learning about the polyvagal and like talking about, parts of the body and parts of the brain. But I think because I sometimes think, um, I don't know, it's hard to say. It's trendy in its words, but I like to have the, experiential part, but
Yeah, for sure.
it validates. Anyway, so um, there's one more point I did think about making today, and I don't know if you got it. I sent you, did you get an email from me that I sent
I,
late last night?
you wrote a blog,
Yeah,
little
did you read
post.
it? You
I
don't
read it
have to
this
read it now.
morning. I read
Okay,
it this
that's fine.
morning.
You read it? Did you say? Oh, you
Quickly
did.
while I was waiting for my client to come on.
I was thinking about that because if I had my way in the world, and as a supervisor, I feel like, and no one would want to put up with this, I'm sure, but maybe in group trainings. But
Uh-huh.
I know that the most valuable, and this connects to what we've been talking about, I think the most valuable part of my training before any, what intervention, what treatment plan, what goal, was to engage in all the activities and exercises that encouraged my ability to be spontaneous and improvisational,
Mm-hmm.
and learning to trust that all I need to be is there,
Mm-hmm. Mm-hmm.
because now I'm comfortable with improvising.
Yeah. And I'm an improviser in
Yeah,
play at
right.
the other job. But for some reason, when I put on this counselor hat,
Okay,
I'm afraid to improvise. I
good
could
to
totally
know.
see I'm the same person, but when I separate them, the museum job where I was so improvisational and responding to children's bodily needs and teaching the parent why they need to do that and why that behavior is happening, then I'm having trouble doing it with the client. Now, when
Okay,
I'm with a parent, I'm
yeah,
trying to teach them and show them
yeah.
that part.
So, um, so when I think about, the point I was trying to get across in that blog was, um, our anxiety, of course. It's like this paradox, the anxiety gets in the way of being improvisational, and
Yeah. Yeah.
but being improvisational helps release the anxiety, but we're too anxious to do it. And um, so yeah,
It's a
I mean,
cycle.
like, I think, oh, the first thing we need to do is then sign you up, not you, but like sign up for a theater improv class.
Mm-hmm.
What? No, because that just builds so much skill and trust in your ability to be present and, listening and responding. It's all about responding.
Mm-hmm.
Um, and if you're up in your head thinking about goals and interventions.
Yeah. Mm-mm.
So I guess that's for every beginning counselor. I feel like um, I would love to encourage that, strengthening that in you, because everything else, it falls into place. And I
Yeah.
know beginning counselors are thinking all about, um, yeah, the treatment
Yep.
goals, and
Yeah.
yeah,
Yeah. And I have different flexibility here because I'm not billing and
yeah,
nobody's asking me to diagnose.
right.
But
Oh
I guess I
no,
want to. Well, when I finish my paperwork and I close a case, I have to check on something.
yeah.
I
Hmm.
mean, maybe I'm missing that, but they're here for trauma. Most
Yeah.
clients we take and keep are around the
Yeah.
trauma issue.
Right.
Yeah,
Got it.
so.
I understand. Good. So,
We ran out of time.
yeah, we're about out. So, oh, it's already 10. The last time I looked, it was 9:54. Okay. Get better at time, Lauren.
That's okay.
You have a 10. So,
And I let her know I'll be about 10 minutes late so I can run to the
okay.
bathroom.
So let's not we're ending, and I just want to end in a way that is true to the things we've been talking about.
Yeah. I mean, you've always given me such freeing statements to ponder, and they don't just ponder, they become me. You've said things, just be with that client.
Mm-hmm.
You said that to me during that class we took with Mary, and I'm like, oh,
Yeah.
I can do that. So
I think that is, yeah. Okay. So just sit for a moment, Lulu, and closed eyes or not, pay attention to your breath and that thought that you say, you hear me repeating over and over. And what does that feel like?
mm-hmm. Mm-hmm.
And allow, what does it feel like to give yourself permission to just be present?
Mm-hmm.
And maybe counter, I don't know if other supervisors, you're getting that, the more traditional clinical stuff around, and it's important, you need that, but
Yeah.
this is what my tattoo was for. It says
Yeah.
Hine ni, and the word is like to remind me to be present.
Mm-hmm.
And because I think everything comes from that. Everything starts with that.
Mm-hmm.
And if you can notice what it felt like in your body when I said, reflect on what it's like to give yourself that permission, then you can start to notice when you get out of that place in a session, when you start going up in your head.
Mm-hmm.
And then try to recall that permission and just try it.
Yes. That
And
makes so much sense.
you won't be like Zen the whole time, because you got a brain and you got thoughts, but notice when those thoughts are taking you away, because being present is where the interventions come from. I think, not vice versa.
Right, exactly.
Mm-hmm. And you can make mistakes. It's okay.
Right.
It might, something you think is happening and you respond in a way, it might not work, but then there's beauty in reflecting on that even with the person, right?
Exactly. It's good modeling.
Yeah, it is.
Okay.
Well, thank you. That was wonderful for me too.
Thank you.
And
I'll see you next week. If you want me to think about something, email me.
yeah.
Okay.
Oh yeah. Thank you for mentioning this.
A little bit ahead.
Yeah.
Ahead.
If something occurs to you over the week that you think, oh, I'd love to talk about this particular person, and then maybe we can even talk about doing some more, like because we still need our toolbox. We can't just make shit up excuse me, teacher, out of the air. But so, this would be good here. This would be good here. Just so, if something comes up, then you want to explore a particular person, or something feels like you'd love to do something arty and you don't know what it is. And okay, this is not what most supervisors say at the end of a supervision session, but I love you and thank you.
Okay, I'll see you next Friday.
Yeah, bye-bye.
Bye.